Again, continuation of the Bermuda Leadership Series. I'm sitting here now with Kris Master-Angelo. And Kris, today we were talking about leaders. Are leaders born or are leaders created?
That's a great question. I believe that great leaders are born, but good leaders can be created. So I think there are a lot of facets.
So what is the difference between a great leader and just an okay leader?
The difference between a great leader is a great leader does not need mentoring. It's innate. They have vision, they have drive, they have grit, and their determination, it's just self-propagating. Whereas good leaders are individuals that will need guidance from external factors and counseling and things of that nature.
How big a role does ego play in leadership?
I think there is a definite ego factor, although I think that a big question is why people do get up in the morning and what is the driving factor.
So for you, why do you get up in the morning?
To learn. In other words, and to actually analyze what gets me up in the morning is knowledge and to problem solve. So only 10% of the population likes to learn new things every day. And I find that learning new things is invigorating and it keeps me motivated. So knowledge.
And the application of knowledge truly is the power.
Agreed. That's what I believe. I believe the more knowledge you have, the more knowledge you have affords you the ability to make better decisions. Even if the subject matter seems irrelevant to your industry, if you're learning math, science, or current events, that information put into your brain will afford you better decision-making skills. And good leaders or great leaders, one of your biggest day-to-day tasks is decision making. Mm-hmm. So if you make poor decisions, there's a compound effect. So to be a good decision maker affords you to be a good leader.
So what role do you feel passion comes to play?
Passion?
Mm-hmm.
Passion is critical. When you're and it's interesting because you need to extract passion out of your children or your peers or your employees. So you have to first of all, assess what is your passion. So, for example, my passion is the elderly and the providing respect in an environment to give them a nice, long life in a respectful manner.
And to be able to die with dignity.
And die with dignity, exactly. And so that's what drives me. But one does need to find out what their passion is.
Mm-hmm, mm-hmm. So today, we spoke about Ernest Shackleton and the challenges, the dream, the vision, and how he had gone to the furthest corner of this planet, lost his ship, had brought his own men, all his men back. What were some of the key takeaways for you?
One of the biggest key takeaway was his grit and his determination. So he was not going to give up. And the second piece is that he role modeled. He took the risk to go back to get help for the men that were remaining on the island. So his grit, his determination, and his role modeling were the key elements that I took away today.
So from the rest of the conversation that we had with the group here in Bermuda in this long-term healthcare conference on leadership, what are some of the things that you're now going to take back to your facility?
What I'm going to take back is, first of all, the seminar is phenomenal. Maybe I'll take you back with me. How's that? But the element is that the discussion of leadership and the discussion to analyze elements of leadership and not to assume that strictly role modeling, but this group afforded the ability for many members to discuss their own personal experiences and identifying obstacles or avenues or conduits to be successful. So the biggest facet that I have out of this is to discuss and analyze attributes of good leaders or great leaders and just seeing how you can practically apply that in your environment, your work environment.
Now, yesterday we were talking about medical tourism and alternative healing. What were some of the things that to you that came across that were really important, and where do the threats to the future of American healthcare lay?
It's a phenomenal question. I was not well versed in medical tourism until yesterday, and you enlightened me as well as other group members. The concept was intriguing to receive care in out of the country, different countries at much, much lower expenses. So the intrigue is, how do they do that? Well, so within problem solving that, probably the biggest factor is medical insurance or liability insurance that doctors have in the States. So that's a cultural thing in the United States. And is it feasible to have a system without that liability? I think the idea is important because of the rising expenses of healthcare internationally. Even here in Bermuda, it's very, very expensive. So those in healthcare, have to think differently and determine how we can change the system. No one has the answer right now, but the medical tourism is a concept, or it's a process that really we should take a very close look at.
It's an opportunity.
It's an opportunity.
And in talking about the opportunity, sort of here in Bermuda, you are having some conversations with Bermudians.
Yes, I am.
And there are transitions. Share with my viewers, what is the transition you discovered last night?
Well, I discovered last night that the local hospital is closing to about 160 beds to transform it into a 90-bed private unit facility that will service outsiders and a medical tourism model, where there is conflict in the impression from the people, the Bermudians, because how are they going to be serviced?
Where are they going to go? What are they going to get?
Correct.
So it's going to create a business opportunity, but also
Not
a substantial...
to have my medical care, it would be considered leakage. So the concept may not work in the United States because of this. And it's fascinating to me because when I was in Bermuda a year ago, and I was sitting there, that's when it came to me, the ACO model, if the man that lives in Bermuda goes to North Carolina for his knee replacement, King Edward's Hospital is not aware that he now needs an antibiotic before he goes to the dentist because they have no knowledge of the knee replacement. So
it's going to be a lot of issues in terms of records, sharing of information.
Exactly.
So here, technology is going to have a huge role to play in trying to bring these pieces together. And it's also the onus is going to be on the patient who chooses to go somewhere else to educate the system to what all has happened in the total picture.
Technology is a phenomenal discussion by virtue of the fact that currently in healthcare, the technology is disruptive. And I review over 14,000 medical records a year in my company, and what happens is that when it was paper, it would take a simple 22 minutes to look through a medical record. The implementation of software, well, if the pharmacy has a software, the therapy has a software, the nurse has a software, I have to now go to 3 different points computers to get that information. Now it takes me 2 hours to look through a medical record. So what happens is, if it takes me, an outsider, that longer, how does that affect the care from the nurse, the therapist, the doctor? So take it a step further. If it's going to take me 2.5 hours to look through a medical record within the nursing facility, well, everyone thinks that, well, that will be the answer, but what happens is once they get the software that'll cover the continuum in the nursing facility or the hospital, what about when I go to Bermuda for my hip replacement? Where's my medical record then?
So again, we're going to have to now start finding ways of how that technology will get all the facets talking to one central component.
Yes.
Everything getting stored, and so you go click and here's the information.
That's right.
Opportunities for entrepreneurs.
Big
opportunity for you.
Big, huge opportunity, yes, yes.
Thank you so much for sharing your views, sharing sort of the impact, and we'll continue on the series in the next few days.
Thank you very much. You're wonderful. Thank you.